Hi, my name is Dr. Eric Singhi. I'm a thoracic medical oncologist at the University of Texas MD Anderson Cancer Center. Really excited to jump right into some exciting presentations that we're going to hear at the World Conference on Lung Cancer. That's going to be happening in San Diego in September. There's a lot of exciting presentations that are planned, but I'm going to focus on some of the presidential sessions that are planned, and we're going to have really nice discussions after we hear the presentations. So first, I'm really excited to hear about some updates for our patients with early stage resectable non-small cell lung cancer. As you know, there's been a lot of advancements over the last few years in this space for our patients, especially with the introduction of immune checkpoint blockade in this setting. And so we're going to hear two really nice presentations. Looking forward to it. The first is perioperative versus neoadjuvant nivolumab for patients with resectable non-small cell lung cancer. And there's going to be a patient-level data analysis of the CheckMate 77T study versus CheckMate 816. It's going to be presented by Dr. Ford. And I think the question that a lot of us have faced in clinic is when we're choosing between adjuvant therapy, choosing between neoadjuvant therapy, and then of course, perioperative therapy, how do we choose? And so I'm really looking forward to this patient-level data analysis of perioperative versus neoadjuvant immune checkpoint blockade in resectable non-small cell lung cancer to aid us in how we make that decision. Another study that I'm really excited about is the NeoCOAST-2 study, which is a phase 2 study that's looking at the efficacy and safety of neoadjuvant durvalumab combined with novel anti-cancer agents, novel anti-immunotherapy, along with chemotherapy followed by adjuvant durvalumab plus or minus those novel agents specific to patients with resectable non-small cell lung cancer. And so the question that this is really asking is, moving beyond our conventional PD-1 and PD-L1 inhibitors in this space for patients with early stage resectable disease, can we safely and efficaciously introduce novel immunotherapy molecules? And so this will be really exciting to see what's happening in this landscape for our patients. When we fast forward to the metastatic setting, there's a study that I'm very excited to hear about, and that's for patients who have metastatic non-small cell lung cancer without an actionable mutation. And the study I'm referring to is the Harmony-2 study. So this is a phase 3 single region, multi-center, double-blinded phase 3 study. It's conducted in China, and it's with the drug ivonescimab, which is a PD-1 VEGF bispecific antibody, versus pembrolizumab in the first-line setting for patients who have PD-L1 positive metastatic non-small cell lung cancer. We've already heard with the press release that ivonescimab shows significant progression-free survival improvement across all subgroups, which includes PD-L1 low, PD-L1 high, and then also squamous and non-squamous histologies. And so I'm really looking forward to breaking down the data. And we've heard that this is really the first drug to show a clinically meaningful benefit over pembrolizumab in a phase 3 setting for metastatic non-small cell lung cancer. And then lastly, what I'm really excited to hear about too from the Presidential Symposium is updates for patients who have HER2 positive metastatic non-small cell lung cancer and what's going on in the anti-HER2 therapy space for these patients. And so we're going to hear about updates from the phase 1, phase 2 SOHO-01 study, which is looking at the safety and efficacy of BAY 2927088 in patients with HER2 mutant non-small cell lung cancer. And then we'll also hear about the BEAMIAN Lung 1 study, which is a study that's a phase 1B trial of zongertinib in patients that are very similar to the patients that were in the other study that have HER2 mutant positive non-small cell lung cancer.